Besides MCHIP giving technical assistance to Ministry of Health, that is NASCOP, in implementing prevention with positive in the general population, that is targeting those who are HIV positive, MCHIP did also give TA to the Ministry of Health, that is NASCOP, and the NAC again, to target the key population, female sex workers, and the MSM, that is men who have sex with men. And this is one of the cohorts that has been greatly affected because of HIV. Specifically, MCHIP did build the capacity of the organization that implement prevention among the sex workers, organizations such as SWAP. We have other small implementing partners that target the key population. Specifically, MCHIP did build the capacity of their leaders to provide prevention with positive among the infected MSM or sex workers, so that when they are dealing with their clients, they are able to protect their client and they protect themselves from getting other STIs. That's one area that MCHIP has really worked, and it's a very hard population actually to reach with other programs. The video that you're about to see is actually some of the areas that MCHIP has worked, build the capacity of those sex workers and the men who have sex with other men. And from the video you can actually see how difficult it is to get these people and talk to them, and they build their capacity to talk to their clients or their customers about how to protect themselves, how to use condoms, and how to adhere to medication. We've already built the capacity of all the trainers nationally from all the regions, and currently prevention with positive is being rolled out across all program areas.
My name is Evelyn Denya. I work in SWAP clinic. I'm a counselor, and at the same time I'm a prevention with positive officer. Japiaigo have trained me on capacity building on prevention with positive. That is what I'm implementing in SWAP clinic. We trained about many pillars, how we can prevent those who are positive, disclosure, about how you can disclose to your partner, how you can go and test your kids, your children, yeah, and the benefits of testing HIV. Japiaigo means a lot to me because I was able to disclose my status to my spouse and also to take my children to be tested. The best part of my job is how I see some people change their minds because of the counseling and the explanation about the issues of HIV, and how to prevent others who are not positive to remain negative. Most of the cases in the clinic, when one of the partner tested positive and other one tested negative, there are some issues. In all that, we had made to settle all those disputes. The prevention with positive training has helped me a lot because I've applied some of the precautions to my family, because up to now we are still discontent. When I knew if you are under medication, the chances of infecting your partner, it's very low. That's why I came in SWAP, and then I requested to be under ART. I like my work because of how I change life to especially the sex workers whom I'm working with. Those who are positive, by maintaining their health and also by living positively and not infecting their clients, and correctly and consistent use of condom.
After the training, it helped me so much. It was very important for me to get such a training, especially on the side of adherence. So I knew the importance of adherence, taking medication at the right time, the right way, and whenever I feel something unusual in my body, I run to the doctor and explain. So it was very important for me.
Okay, it has helped me because I live positively for like 10 years. And, one year ago I was like down, I couldn't hear well. So after the training I knew the purpose of taking time, and also the intake of drugs and the proper adherence. Because adherence is not drugs, so we are taught not drugs alone. It goes with the food and the condom use, because we are always having sex, so condom has to be there, food, and then drugs too.
I'm very happy when I'm talking about disclosure, because it's a topic which got deep in me, because I may not disclose to my mother. When I'm talking to the participants, we just look for somebody who is the right person to disclose to, where to disclose this person about our status, how to disclose it, and why should we disclose this to them. So it is so interesting when I'm talking about disclosure, and it actually helped many people through my talking to them.
Drug and substance abuse. I learned that drugs, all alcohol, as I may say, alcohol causes a harmful effect on the body to someone who is using ARVs. So that is a challenge that the MSM have. So the training that I got and the skills that I got from the GPEGO has helped me a lot to tackle that personally and for the community. Yeah.
And again, because it's like we have a call to the community. I'm saying we because I always see how we work as peer educators here in Oimas. It is always good for us, and it has worked for us. When we are talking to PWPs, it's always good to tell your story first before you hear from them. Now that time you give them time, you create a rapport, so they are free to tell you their story, and maybe from there you discuss a lot about prevention with positive.